If you're someone that just had a knee replacement, then you're gonna wanna watch into the end of this video because today I'm gonna show you why you need to be paying more attention to your scar and show you exactly how to massage this area to improve the function and the healing of your knee. Now, if this is your first time here, my name is Dr. Mike and I'm a physical therapist providing tips on how to build strength and longevity with your body. Now, one of the many areas that often gets overlooked after knee surgery is what is going on with the scar and the tissue surrounding the knee. A scar that hasn't been addressed is often tight, itchy, and can even affect your mobility and lead to pain. But there are some simple and effective techniques that you yourself can use at home that can improve the elasticity and the pliability of your skin, which can lead to an overall healthier joint. Now, these techniques are called scar mobilization or massages, which consist of rubbing or moving the skin around the scar in a firm manner to reduce any skin restrictions. Now, you can usually perform these from anywhere between 2 to 5 minutes at a time, up to 3 times per day. Not only will this improve the flexibility of your skin, but can even help your sensitivity and pain management. Now, before we dive into these techniques, it's important to know a few things to ensure that these methods are appropriate for you. So the first thing we want to make sure is that you are at the appropriate time of your healing, meaning that you perform these techniques anywhere between 4 to 6 weeks and not too soon right after surgery, because your knee is just not going to be able to tolerate that type of manual therapy. Number 2, we want to make sure that the incision is closed, meaning that any staples have been removed and we're noticing no open wounds or no drainage coming out of the incision. And the last piece is informing your surgeon about the techniques that you're going to be using. They are the person that performed your procedure, so you want to make sure they are well informed about these new techniques that you're going to be using. Now let's go ahead and jump into a variety of different techniques that you can use. All right, if you're new to any massage therapy or manual therapy techniques, it's going to be very important that you're utilizing these techniques not just on the surgery leg, but also the non-surgery leg as well. You're definitely going to want to assess what your normal tissue feels like and the non-effective side as you're performing this on the tight side or the surgery side, okay? So we're going to start with the generalized technique that is going to get you to start to just increase the warmth around the tissue that we're going to work on. So I'm just kind of using both hands together, applying a little bit of pressure, and I'm just warming up the joint and warming up the tissue for the techniques that we're going to get ready to use, okay? So I'm just going over a generalized pressure, not really squeezing or anything like that, but just kind of slowly moving my hands up and around the incision. Now, for these techniques, you're going to utilize your thumb, your index, and your middle finger on both hands. So the first technique we're going to get into is some circular motions. And when we're working down the incision here, you don't want to just be limited to just the incision. You might notice that you hold some tightness past the incision, maybe below the kneecap here, and even above next to your quadricep tendon up here as well. So the first motion that we're getting into is we're going to go in these clockwise direction as well as counterclockwise. So we want to work in both directions, but we're going over the incision and we're using our thumb to go all the way down the incision, noticing to see if I hold any restrictions or tightness in the area. If you find a specific spot that feels like it doesn't move, then you can spend an extra 20 to 30 seconds basically moving the tissue, trying to get some of that fascia and that tightness to release there. So you'll go all the way down to the bottom and then work your way in opposite directions all the way to the top of the incision until you're just about done there, okay? The next technique we're going to get into is a skin rolling technique. So you're going to use your index finger and your thumbs. You're going to grab a hold of that top layer of the skin and you're going to slowly kind of roll it down all the way up. And notice I still have a hold of the skin. I'm not necessarily pinching hard. I'm just trying to get a hold of the skin and I'm just allowing my fingers to just roll, and I'm utilizing that incision going all the way down. Now, it might not be this easy to grab a hold of the skin. You're just going to grab whatever tissue you can and slowly just work in small increments where you're going all the way down to the bottom of the incision and then working your way all the way to the top. I not only like to focus on these vertical directions, but also going in some diagonals and even horizontal. You might hold some more tightness along the quad area, maybe on the inside of the knee. And just because you're working on these techniques along the incision, you might even find some other tight areas surrounding the knee joint as well. Next, we are moving on to a cross friction technique, which we're going to utilize our thumbs for this technique as well. And we're going to now go in this perpendicular fashion across the incision here. So here now, instead of going up and down, now I'm going across the incision. Notice you can even see beneath my thumb the incision moving from left to right. And I'm really just trying to see, where do I hold the most stiffness or tightness? I'm going to go back and forth, up and down that incision, just to see if I can increase that mobility around the skin area here. And you're just going to keep going side to side with this technique here. Moving on to the zigzag technique. Here you're going to use both thumbs, and as one thumb is moving in one direction, the opposite thumb is going to be moving in the opposite direction. So you're going in this zigzag fashion. So here you're working your way down, all the way down the incision. You can kind of switch thumbs there. You're going back and forth, kind of finding the areas that maybe just don't move as you would like them to move here. And during this time, you're still kind of, just to get a basic assessment, you're utilizing these techniques, going back and forth to see, does my surgery side start to feel nice and mobile, kind of like the opposite side as well, okay? The last technique we're gonna get into is when we're pushing towards the incision and pulling apart. So here you're using those thumbs. We're kind of applying a little bit of pressure, moving the tissue towards the incision and then pulling it away from each other. Once again, pulling it towards, pulling it away. This is also in a horizontal fashion, going kind of perpendicular to that incision, seeing what it feels like. Is it more restrictive when you pull away, or maybe when you're pushing that tissue towards each other, okay? Now, these techniques are not the end-all be-all, which means that they are made to be used in conjunction with the exercises that you're still working on for your flexibility and your strength. Now, if you want to learn more about how to do that, I've created a surgery playlist where I have a variety of videos that go over effective exercises and techniques that you can use after knee surgery. And if you found this video helpful, please support me by giving this video a like, subscribe to the channel, and leave a comment below if you have any questions that come up. I'll see you in the next one.